Today we're looking at Chapter 13, how microbes and humans interact to cause infections and diseases, and we're going to talk about the epidemiology of this. Our body exists in a state of ever-changing equilibrium, and sometimes the balance tips in favor of the microbes. And there are many interactions between the human body and the microorganisms that involve in the development of biofilms. So colonization of the body is a constant give and take, and as I said, sometimes it tips in the balance, or the balance tips in the favor of the microbes. Now, microbes that engage in mutual or commensal associations with humans, that's our normal resident microbiota. Other terms you might use are indigenous or microflora or normal flora or commensals. Vocab terms you need to be familiar with: infection is when the pathogenic microbes penetrate the defenses of the host and enter their tissues and multiply. A pathogen is a microbe that acts as an infectious agent, and an infectious disease is an infection that causes damage or disruption to tissues and organs. And you can see here how microbes adhere to our exposed body surfaces, and they can colonize and cross lines of defense and enter our sterile tissues and cause infections. And hopefully our defenses hold that pathogen intact or in check, but sometimes it will disrupt our tissues and morbidity or mortality can actually occur. Now, our normal resident microbiota, or our normal flora, we need to remember that our microbes outnumber our human cells as many as 10 to 1. And the most significant interactions here, they provide a protective and stabilizing effect on body surfaces. They are involved in the maturation of our defenses and the development of our immune system. I know that when I started teaching school, I had a sore throat constantly, but after that first year, my immune system developed more because of all the germs in the school environment, so that I don't get sick every time something comes along. And microbes also can invade and grow in our sterile tissues and cause disease. Now, our internal organs and tissues and fluids should be sterile or free of microbes. The term is axenic. And if it's in contact with the outside environment, we've got some resident microbes. We've got transients, which are only there for a short period of time, and then we have the residents that are going to stay around and become more established. Places that we find these normal resident microbes, of course, our skin and any contiguous mucous membranes, our upper respiratory tract, like our oral cavity, our pharynx, our nasal mucosa, our GI tract, the outer opening of our urethra, the external genitalia, the vagina, the external ear and ear canal, and of course the eyelids and the eyelash follicles. Generally, our resident microbiota are stable, but it will fluctuate with our general health, with our age, diet, hygiene, hormones, and drug therapy. And sometimes the microbiota benefits the host by keeping other harmful microbes from overgrowing. This is microbial antagonism. Endogenous infections will occur when the normal flora is introduced to a site that was previously sterile. For instance, when E. coli enters the urinary bladder, it'll cause a urinary tract infection, a UTI. But you can see here all your internal organs that should be sterile or microbe-free. You've got your heart, your circulatory system, your liver, your kidneys, your bladder, lungs, of course your brain and spinal cord, your sinuses, your glands, your bones, your eye, Um, and they can be, um, within the organs and tissues, you've got some other sterile fluids like blood or urine or cerebrospinal fluid or semen before it enters the urethra or saliva before it enters the nasal cavity. Now, to maintain those normal flora, that is essential to our health. And we can obtain these flora through the birth canal by feeding and breathing. And they create an environment that prevents infections and can help our defenses. But anytime you take antibiotics or you have diet changes or disease, it can alter this flora. And so a lot of times you'll take probiotics where you introduce some known microbes back into the body. Like when you take antibiotics and they cause diarrhea, you can eat yogurt to introduce the lactobacillus back into your large intestine, or probiotics that have that same bacteria there to try to control the other bacteria that can cause problems. So that leads us to our first concept check. Normal resident microbes are absent from where in your body? The axenic sterile environment should be in the lungs.